So we're going to move on to the ferret clinical exam. Ferrets, generally speaking, are quite friendly, gregarious animals, but they are very, very fast, and they're basically solid muscle, and they're very flexible. Like any other species, we're going to start at the front and work our way back. Most of them are kept as pets now, although you will see quite a few working animals, potentially depending on what part of the country that you're working in. They have been domesticated for around 3,000 years, and compare that to the fact that rabbits have only been domesticated for 500. So we start at the front, and I'll often just support the ferret's length against my forearm. I use my left hand to cup the head and have a look at the teeth and lift the lips there. But if it's a ferret that you're unsure of, then what you can do is scruff the ferret, and generally speaking, they'll either yawn or relax their jaw down so that you can have a really good look in the mouth. If this was a hob, because we've got a gill here, which means female ferret, the hobs are twice the size, so I would always support the back end, and you can see that I am actually supporting her weight by cupping her between my forearm and my chest. But that allows me to have a really good look at her teeth, because they are very, very prone to dental disease. So we're going to have a look in their eyes and their ears. Now, ferrets have got very delicate pinnae, and they normally have quite dark earwax, so it's very easy to miss ear mites in them. But if you just take a cotton bud and take a smear of the wax and put it on a slide, you'll be able to tell. So move their front legs to check range of movement, and palpate down their spine. And despite their long body size, it's very unusual for them to get spinal disease the way that we would see in Dachshunds, for example. Check the range of movement of the back legs. Check this for thoracic compliance. They should have a very springy thorax. And if they don't have a springy thorax, then that can indicate that we've got dilated cardiomyopathy, or that we have juvenile lymphoma going on in there, and we need to investigate that a bit more thoroughly. Palpate the abdomen. Checking all the organs. Have a look through the coat, looking for any parasites, looking for any sores or crusting or dandruff or that kind of thing. We're going to also check the chest. As you can see, ferrets are very active animals. They're either in full motion or asleep. And we're going to also take the heart. Now, in ferrets, because they are so long, their heart is much further back than you would expect. So with most domestic mammals, we expect the heart to be just below or behind where the elbow sits, but in ferrets, it's about the rib 8. I'm going to check the length of their nails and have a look at the genital region. In gills, the vulva is just below the anus, and in hobs, the prepuce is about a third away the ventral aspect of the abdomen. If you're having difficulty restraining a ferret, then the vast majority of them will respond quite positively to a treat like unsalted, unsweetened peanut butter. It's not something they should get often, but it can be useful just to make that animal stay still for a period of time, allowing you to perform such things as nail clips or administer injections.